All right, good. Well, thank you guys for joining. I really appreciate everybody being here on this Tuesday morning. I'm Rhonda Barcus. I'm the manager for Community Population Health, and I'm going to be sharing a little bit about how to engage staff around your population health project. So I'm going to go ahead and get my PowerPoint started first. All right, so you guys should be able to see my screen. So the topic today is beyond education, really engaging staff to impact population health. This is actually our first webinar, and we will be doing 2 a year. So I'm glad to be able to kick this one off because I think it's an important topic, because I know that the success of your project really depends on your ability to engage staff and leadership. So just as a reminder that we are the Rural Health Innovations, and we are part of the center. And we work all across the country with technical assistance, specifically in rural health. And as a reminder that this project is funded by the Minnesota Department of Health, Office of Rural Health and Primary Care. All right. So what we know is that getting your leadership and frontline staff to care about population health is really going to impact the success of your project. What we also know is that we do this not just by sharing information with folks, but by really crafting a message that engages their heads and their hearts. So that for the next 50 minutes or so, I'm going to be sharing ideas on how to engage staff in learning about population health. And some of the concepts that I'll share might be familiar to you. Maybe you've used them in education and training in the past. Some of them might be new. And I'll also be sharing some real life examples of folks that I've worked with in the past and how they use these different concepts to get their points across to staff and leadership. And some of those examples I'll share are going to be specifically related to population health. Some of them are more healthcare in general. But what I really hope to do today is to get your minds thinking and being creative about, if I'm really going to engage the leadership and the staff in my hospital to support this project, what is the best way that I can really engage them? And it's not going to be just talking at people. So sometimes it's doing things a little bit differently. Sometimes it's taking risks to present information to them in a different way. And so that's going to be the point today. So we're going to talk a little bit about effective strategies that lead to learning. We'll talk a little bit about messaging and how the message needs to be different for your stakeholders depending on who they are and what drives them. And then I hope that you'll begin to think about, okay, how can we utilize some of this as we're rolling this out to our staff? So I'd like to do kind of just a check-in with everybody. If we could just go around and let us know who you are, your organization, and then remind us what your population is that you're going to be working with for this project. And then how well do you think your hospital staff, leadership, nursing staff, providers already understand population health? So how about Kimberly, can I just go ahead and start with you?
Sure. So I'm Kimberly Bernarski. I'm the clinic quality manager, the OC health manager, and our telehealth coordinator here at Lakewood Health System. And I'm going to defer to Chandler on the other questions.
Okay.
I think he's a little bit more versed in it than I am. So okay. Sorry, Chandler.
No, that's
yeah. So we'll go to Chandler next.
All right. Yeah, I'm Chandler Trout. I am a population health data analyst is my title. So the population we chose to focus on for this project is our congestive heart failure patients in our Medicare and Medicaid contracts through our shared savings program and our IHP.
Okay. All right. Thanks, Chandler. How about Emily? Will you check in?
Yep, I'm Emily Masters, Chief Human Relations Officer at Windham Area Health and oversee wellness and population health here. We've chosen to focus on the Hispanic population that may be pre-diabetic or have high blood pressure. And I think I think that our leadership does understand population health very well. I think where we need to do a little bit more work on education is in the nursing staff and the providers. They see some of the challenges that this population presents, but not necessarily the population health perspective.
Okay, thanks, Emily. Yep, that's often the case where they see kind of the issues with the different population, but don't really see the bigger picture of what's driving this. Okay, thanks. How about Julie?
Good morning.
Good morning.
Julie Carey, Central Care Clinic Nurse Manager. Our focus was on also the diabetic population, specifically the non-English speaking over a specific age, and just how we can pull in our community resources and staff internally to better educate and have those available resources for those folks. I think as far as the clinic staff, we have a pretty good understanding of population health in general, quality measurements and such, but I think that there isn't as much on the hospital side. And so that was one of our focuses as well, is to try to work together so that we're kind of all on the same level with knowing where those measurements are, how we're going to get there, and what's best for our patients.
Okay. All right. Thank you. And Katie.
I'm Katie Beyer. I'm also with Long Prairie. I am the community wellness supervisor there. I would agree. So we are focusing on the Hispanic population, like Julie had said. I would agree to the point where I think that we're getting there, like to understanding population health, but I think there's a lot more to go on how that connects back out into the community. I think we're like other hospital organizations where we focus on, you know, the clinic and the treatment and the, you know, the hospital services and stuff like that, but we don't always link in the social determinants of health when it comes to, you know, overall wellness and prevention. So we're getting there, and it's really exciting to be a part of this project because I think this will just give us leverage to continue on.
Yep.
So, yep.
Okay. All right. Thanks, Katie. All right. So, you know, as we're going through this, one of the things also that we know is that people tend to learn better when they're engaged and when they're sharing and asking questions and sharing ideas. And so I'm really going to ask you all two things. One is to stay present as much as you can. I know that there may be some things going on in your world or your background right now that could be distracting, but as much as you can be present for this, I would appreciate it. And then also, as much as you are able to be interactive and ask questions, jump in, feel free to interrupt me at any point. If you need to put something in the chat box, you can, but I really like it when folks are willing to take themselves off mute to share ideas. Because what I hope that, again, that this presentation will get your wheels turning around new ways to get your staff, your providers, your leadership engaged. And so we know that learning is a lot more fun and interesting when folks are willing to get involved. So, okay. All right, so I'm going to pause. So before I go into the teaching piece, Keely, do you want to go ahead and put up the pre-webinar poll question?
Yep.
So the question is, what is your confidence in educating hospital staff about population health in ways that engage and motivate them? Not confident, slightly confident, moderately confident, confident, or extremely confident. So if you will go ahead and check the box that best describes where you are in your own confidence. And then at the end of the webinar, we will ask the same question. Okay, Keely, if you'll let me know when it looks like we've got the responses in.
I think we're waiting, let me see here, for 2 more.
Okay.
And then here are the results.
Okay. All right. Thank you. Thanks, Keely. Okay. All right, so how we don't learn. We know this is very true, that long, endless PowerPoints where somebody just talks at us is not very helpful in learning. And you can actually see this pyramid that describes how we best learn and how we tend to not learn so much. So lecture and just reading. For most people, the learning is very difficult and we tend not to retain as much. What we know certainly is that we tend to learn better when we get to practice what we're trying to do and then teach others. And so that's why certainly in healthcare, we do so much teach backs with our patients when we're wanting to make sure that they understand their medications when they go home and things like that. I do remember once that I went to a workshop. I have my background is in behavioral health and went to a workshop. It was a full day workshop. I do not remember the topic and I don't remember a single thing that I learned. What I remember is that we were in a big ballroom. The speaker read from his PowerPoint the entire time. He had the lights off and he had a monotone voice. And so we know again that that is not how we learn. I do think that it's important when we are trying to engage folks that if we tend to be a little bit flat and monotone, I think we got to work at that. We've got to be able to be more animated and engaging. When I was in high school, I worked at Walt Disney World. And at Disney World, they talk a lot about onstage behavior. And when you're in front of the guests, at that point, it's really important to be positive and be fun and be playful with people. And I think that when we're trying to engage folks in something we care about and get them to really join us in caring about it as well, it's important for us to be inviting, whatever that looks like. So monotone does not help. So I think that again, we need to work on that if that's certainly an issue.
Hey Rhonda, are you able to get your PowerPoint back in presentation mode?
Yes, I just realized that as well.
Thank you.
All right. So there are 4 principles around adults as learners, and we're going to talk about these in a little bit more detail. But the first one, and the first letter of each of these, M-I-M-E, is MIME. But 4 principles for adult learners that we need to always keep in mind. The first is motivated, understanding the why for them, and the WIFM, which we'll talk about in a minute. Then we need to inform. We need to provide teaching that responds to all of their learning styles. We need to monitor. We need to create a relaxed environment where learners feel valued and respected. And then lastly, we need to engage, using experiential learning whenever possible. So the first one is around motivating, understanding the why and the WIFM. And WIFM means what's in it for me. And so if you are trying to engage your providers, for instance, you have to think about it from their point of view. What's in it for them? Why should they care about population health? If you are trying to get your community engaged in this, think about, again, what are they going to care about? And so certainly the motivators might be a little bit different for nurses or techs or environmental services or ancillary staff versus your C-suite, your providers. So it's really important to think about what is the messaging that's going to resonate the most. And we need to think about what needs to be the messaging to really engage their brain, but also their hearts. So it's really important as we're thinking about reaching out to these different stakeholders that it's not one size fits all. We might have to really change our approach depending on who we're trying to engage. So again, you guys already started identifying some of those stakeholders that you're probably going to need to engage the most. This is a concept from Franklin Covey organization, and it's called the line of sight. And the line of sight says that whatever our strategy is, whether it is population health, whether it is employee retention, whether it is creating positive patient experience. For any strategy, we have to be able to create a line of sight for every level of the organization so they understand how their work impacts the strategy. So for instance, for population health, it sounds like a lot of you probably have already engaged senior leadership. And my hope is that they are certainly on board and they understand the importance of being partnering with you in this project. But then the managers, the front level managers need to know exactly what is my part as a manager and how do I impact population health. And lastly, I think this is critically important is the frontline staff. Because if you think about it, the folks that tend to drive population health are the folks that are having that day in and day out contact with the patients. And that's often your nurses and your techs. So again, helping those folks to know this is what my role is in population health. This is how I impact it. This is how I make a difference. This is just a graph that talks about the projected federal spending on Medicare and Medicaid. Out of curiosity, which population, or sorry, which part of our leadership or our staff at our hospital are really going to love looking at something like this? Who's going to resonate the most with this?
Probably a fiscal type department.
Yeah, folks that are really interested in the spending and they need to understand, really tying in the spending and why, for instance, Medicare is not sustainable at the rate it's going and why we really need to switch gears to population health. Yes. So again, thinking very clearly about, okay, what's in it for me? What's my role in population health? And then what kinds of visuals or what kinds of presentations am I really going to respond to? Chances are this is not going to be quite as engaging for the frontline staff. And I'm going to pause for a moment. So for your nurses and your techs, what do you think would engage them? Like what is going to hook their heart or their heads? What really matters to them when it comes to population health?
When we met with, when we did our on-site / virtual meeting, one thing that really stuck out to me is that, especially with our population, which is Hispanic, you know, there's things about providing care for that population that's difficult for the nurses. They have to use a translator. They have to use language line. They have to, you know, they're basically knowing that there's a lack of connection between them and the patient. So what we heard from them is that some of the improvements that can be made through population health actually make their job easier too. So kind of taking it from that approach as to what makes this, you know, how can we make your job easier and then achieve our goals too?
Perfect. And that is definitely a what's in it for me, right?
Yeah.
Yeah, absolutely. Other thoughts about what's going to engage your frontline staff?
I think oftentimes they're pretty engaged just in like patient outcomes in terms of care. I mean, that's, you know, why they got into the field that they did. I think those are pretty motivating factors for them. And especially, you know, not necessarily presented in a data type format, but if you can just, you know, find some stories of how, you know, whatever project you're working on impacted this specific individual in this positive way. I think those types of things really resonate with that frontline staff.
Absolutely. So when you're able to really connect with the heart of caring for the patients, feeling proud of the work I'm doing, knowing I'm making a difference in somebody's life, and and you know, I'll mention storytelling later, but that's such a good way to engage them. Any others? Okay. All right, so then the I is to inform, and that's providing information that actually responds to every learning style. And you all know, I'm sure, that you've got visual learners, auditory, tactile, and kinesthetic. And so again, instead of a one size fits all, finding ways to engage any of your learners, regardless of which learning style is easiest for them. So, visual learners are going to probably want demonstrations. They like lists. So things like videos, illustrations, written instructions, graphics are very helpful for the visual learners. Auditory are more likely to want verbal instructions. They might like discussions, and they might need to listen and repeat to recall the information. And again, so for the auditory, verbal instructions, music, discussion, audiobooks. Tactile learners are going to want to be taking notes, maybe doodling or drawing to capture different concepts, and would do well with hands-on activities. And then kinesthetic learners, they like to be moving around, and I am never offended when I'm doing any kind of education or training when somebody gets up and walks around or stands in the back of the room, because I know that's very helpful for some people. So sometimes the kinesthetic learner also just is going to want to do and not just watch or listen. So again, doing a PowerPoint for everybody is not going to be very engaging. I do want to talk a little bit about some of those on the left side and give you guys some ideas around this. And again, what I encourage you to do is just think about, okay, is there something I can do with that in order to really reach my stakeholders? So in my presentation near the end, I have a resource page, and it's going to have a lot of links to podcasts and videos that I have found. A lot of them were created by hospitals for their staff. So I encourage you guys not to invent the wheel if you don't have to. Go out there and use some of those videos and podcasts in order to educate your staff. Sometimes some folks are also starting to actually create their own videos for staff. So for instance, hospital I worked with, the leaders were really challenged with staff did not want to do bedside report. And there were a lot of concerns about bedside report, and it seemed like they just kept doing the same education over and over again. So one of the things that one of the leadership teams did is they created their own homemade video on bedside report, on the way to do bedside report correctly and the way not to do bedside report. So they used some humor in it, and they also used some frontline staff to play parts. And again, that was more fun for people to learn than to listen to their manager tell them one more time why they needed to do bedside report. Group discussions can be really good. So throwing out an open-ended questions and have people talk through their thoughts about that. Games can be helpful. I know that places that I've worked have often used things like either Jeopardy to teach concepts, or the Wheel of Fortune. Those have been two very popular games that people have turned into learning opportunities for their staff. And that's certainly, again, a lot more fun, especially if you have prizes. Themed presentation. I remember years ago when core measures were first being talked about, I worked with some young leaders who were being groomed for leadership. And they had to take on this project for the hospital to research core measures, what they were, and then teach staff what core measures were. So a couple things that they did, took a theme and they used the theme throughout it. So since it was core measures, they decided their theme was anything involving apples. Get it? Core apples. So they had the interactive posters, and then they had, again, there were a lot of visuals of apple kinds of things in order to talk about core measures. They had a drawing for a gift certificate from Applebee's. They had apples on the table, so people would come up and look at their poster, or and they had other snacks that involved apples. But again, it was a kind of a nice hook to help people remember what core measures are. So using a theme, whatever that might be. Chandler had mentioned storytelling, absolutely, because one of the things we also know is that people tend to change their behavior and get more engaged when they have some sort of emotion. So if we can help create emotion, instead of it just being head stuff, but if we can create emotion for folks where they have a feeling of sadness or surprise or concern or pride, feeling proud about something, or compassion for somebody. If you can really get them to have an emotion, then that's more likely to get that person engaged. And then, of course, again, what we do in healthcare a lot is the teach backs. And so one of the things you could do, depending on how much time you have with your audience, is to take different pieces of population health, put them in small groups, and have them come up with an idea of how they're going to teach that concept to the rest of the team. And then let the small teams teach the bigger team that concept of population health. And again, a lot of times this takes a lot more thinking and preparation, but it really helps to keep people more engaged. Anybody have any other ideas or some examples of how you've used any of these to engage your audience? No? Okay. If you haven't used them, I hope you will consider doing that. So monitoring is just creating an environment where learners feel valued and respected. What we know is that when people are nervous, anxious, afraid, they tend to not learn as well. So again, if you can make it fun, if you can keep it short and sweet, ask for their stories, help them to see how their work impacts population health so that they feel very valued and they know what their role is in helping patients with their health, then that's really important. And then of course, food is always nice as well. And again, you can always tie that to a theme. This is one of my favorites, and that is using experiential learning. So this is where you create an experience for someone that quickly drives home a message. And this, what I love about experiential learning is it tends to engage the emotions very quickly. People tend to have an aha moment, and it drives the point home in sometimes just a few minutes versus a 20-minute presentation. So I'm going to give you guys some examples of this. And again, be thinking about, okay, is there a way we can use experiential learning to help engage our staff or our providers? So sometimes, you know, some of these examples are a little bit risky, I will admit that, and you have to be just the right person to be able to pull this off. So I worked with a manager, and this is not exactly a population health example, but it's an example of how in healthcare she used experiential learning. So I worked with a manager who was very frustrated because every time they were doing leader rounds where they went into the patient's room to see how things were going, and over again, they would see the patient's urinal sitting on their bedside table. Sometimes it had urine in it, sometimes it didn't. And so at huddles, they were talking about, please, you guys, unless the patient prefers it there, please put it somewhere else. You know, maybe even educate them why this might not be a good idea to have it on their bedside table. But staff just, you know, they just were not being compliant to that. So this manager, who is very brave, one day she took a urinal and she put lemonade in it, and she put it at the nurse's station, just sitting it right there where everybody would congregate. Another time she put it in the staff break room on the table where they eat. So when staff walked out, they're like, oh my God, this is gross. Who did this? Who left this here? And they were all just appalled that somebody would be that inconsiderate to leave a urinal sitting on their nurse's station. So then she's like, oh, so don't you think this is how the patient feels when their urinal sitting on their bedside table where they're going to have their lunch? And so it really got people's attention very quickly. And that's what I love about experiential learning. Another thing this very same manager did is during rounding also, it was not uncommon to find the patients' whiteboards in their rooms blank. And we know that patients, you know, the whiteboard in their rooms are so important. It tells them who is my nurse for the day, who's my tech, what time am I supposed to go for a certain procedure, who's, you know, what's the plan of care for the day. And so patients, we know, really care about their whiteboard and that information being accurate. Staff sometimes don't realize the importance of that. So the same manager, during shift, change of shift, the staff would usually come in, they would look at, in the nurse's station, the whiteboard, and it would tell them what their assignment was going to be for that day, so they could start getting their mind kind of mentally ready for what tech they were working with and how many patients they were going to have. And then they would have the sheet of paper that had their assignment on it. So during change of shift, the manager purposely left that whiteboard totally blank and did not have the assignment sheets out. So again, staff walked in, they looked up at the board, there was nothing on there, and they were like, oh my gosh. And it's like, this is a horrible way to start my day. I don't even know how to get ready for what I'm about to do today. So again, some of them were a little angry about that. And again, the manager very quickly then, once people were there and were starting to get upset because they didn't know the plan for the day, the manager again pointed out, this is how the patient feels when their whiteboards are not filled out. So again, experiential learning, that they had been lecturing the staff over and over again about both of those issues and nothing was changing. So she did this and it really got people's attention. One other exercise I want to share is that, or one other experiential learning that I've seen is at a hospital I work with. This is all part of actually new employee orientation, but they do empathy exercises, and maybe some of you guys do that in your hospital as well. So for instance, they, for new employees, they do this empathy exercise to help them to understand what it's like to be an older person and how hard it is then to even manage things like your medication. So they put glasses on them and they put Vaseline on the glasses so that they can't see very well. They put a lot of pill bottles out that the person then has to figure out which pill they're supposed to take when, and they have to sort them. But then they also put gloves on their hands so that it's very hard for the person to even pick up the pills. So again, I think that experiential exercise might be helpful even with population health, as you're getting folks to think about, like some of you guys mentioned, the congestive heart failure with Medicaid, Medicare, or the Hispanic population. I'm just thinking that would be a perfect example to help staff have some empathy with the Hispanic population when you don't understand the language very well, when it's easy to misunderstand, when things feel very confusing and you can misread even cues. So a couple of thoughts that came to mind around the Hispanic population. One is, one time I was shadowing some nurses, and they had gone in to clean up a patient. She spoke Spanish only. They didn't take in an interpreter, but the woman had an accident in the bed. She was a really heavy woman. So they went in, they were very kind, very compassionate, helped her to get cleaned up. As they were walking out of the room, somebody made a comment that was not about her at all, and everybody laughed. But imagine being that woman in the bed, and here they've just cleaned me up, and you're walking out of the room and you're laughing. Imagine what she thought. So again, some of those empathy exercises I think could be helpful for staff with those. Another one that comes to mind is, I remember at one point, a Hispanic patient had their prescription, and it said something like once a day, to take it once a day, ONCE. But once in Spanish is 11. So she thought it was 11 times a day, not once a day. So again, getting staff to think about some of that. I do want to pause again and see if you guys have any ideas on how to do some of these experiential exercises to get staff engaged or on board.
Rhonda, I really like the idea of perhaps presenting something in a different language. I think that speaks volumes.
Mm-hmm. And how confusing that is, even some of the basics, right?
Right.
Yeah. You know, and if I'm working, and so even thinking about the Hispanic population and, for instance, diabetes, thinking about, I don't know, just whether it's the, I would assume that we have like discharge information, some of that in Spanish, but maybe there are some basics, just even coming into the room and not having the interpreter and starting to talk to the person. So, yeah.
I have an idea too, Rhonda. This is Tracy.
Yes.
One of the things I've seen, I've only seen this in an urban environment though, is like a poverty simulation where you're a single parent, you have small children, you have X amount of dollars, you need to get your groceries for the week or the month or whatever it may be. You have to take public transportation, you have an appointment in the middle, and your schedule gets adjusted and your child is coming down with something. And you have to juggle all these different scenarios. And like I said, I've only seen this in an urban environment done and through a volunteer organization that I'm a part of, but it's incredibly eye-opening to go through that. But I think something like that could be translated into our rural settings where there's still some of those things that are going on, and maybe we don't have all the social services that exist to the level that they are in an urban center, but there's still some of those things available too. And I think that can be really eye-opening to our staff that are working in the hospital setting, generally speaking, have a steady income, have insurance, and all those other benefits that go along with it, where the rest of the population in that rural area may not too. So that's something I've seen done that's really can be very jarring.
Yeah. And
Tracy, we in Wyndham, we did that last year with the school, and the hospital helped volunteer, but it was actually the most of the school staff, the teachers and the paras and everything that went through that. It was very impactful. I wish that we had more staff that would have been there to go through it. The other simulation that I've seen are Southwest Crisis Center that handles more, like abusive relationships or crisis situations like that. They also have a simulation that they do kind of like a choose your own adventure, where you're a character and you make decisions that have an impact and you kind of go down the road. And that was really good too. I've been looking for ways to bring that up to our staff here, not necessarily dealing directly with the population that we're focusing on for this project, but those simulations do have an impact, even though they're still, just a simulation.
Mm-hmm.
Yeah, absolutely. And I was thinking also, Tracy, as you were talking about your experience with that, I think that's easily would be very easy to use with rural, but then also to be able to say, okay, you've got this Hispanic diabetic patient, this is going on, and then again, helping staff to think through what it's like to be that patient. Oh, and then the other thing that came to mind is you were also talking about social determinants of health. And I think that would be a good thing to pull into some of this as well, because we know that that's one of the things that's really going to impact the success for our populations we're working with is, are we really addressing some of the social determinants of health? Any other thoughts on experiential learning?
I just had a thought for our project specifically on CHF. I have very little clinical background knowledge, so like as we're going through this ourselves, I'm learning new things every day, and just thinking from the perspective of a patient who might have got a new diagnosis, and we're trying to help them understand their disease and how much information is probably being thrown at them all at once. If we could maybe do something with that and flip the script to try to help ourselves understand how much information we're throwing at the patient. Yeah, something along those.
I love it. I love it. And just, and so I'm imagining, you've got my head going. So I'm imagining like the staff are sitting there and you're like giving them instructions on something, which maybe is on a topic they aren't even very familiar with.
Yep.
And then asking them to recall how much information did they even capture and what was their understanding. Because I think we do that a lot with patients, especially when we use medical jargon instead of real world words.
Yeah.
Yeah, great idea. Any other thoughts? So it does take a little more work, certainly, to think through these experiences, but I encourage you to maybe get with a team, especially if you have some folks who are a little bit more outside the box thinkers, brainstorm with them, because I found that when I'm brainstorming with a team, we come up with some great ideas because we just start bouncing off of each other. So I encourage you to do that. All right, thanks for your thoughts and ideas. So as you're thinking about how you're going to engage folks, the other thing I encourage you to think about is to develop a working definition for population health. So here we have, this is from the AHA, population health serves as a strategic platform to improve the health outcomes of a defined group of people, concentrating on 3 stages, and then it lists them. What I encourage you to do is to take the definitions, but again, make them your own so that they are going to resonate with folks. So frontline staff, maybe you're not going to love this definition quite so much. So again, using words depending on probably the culture of your hospital, just really thinking through what's a definition that's going to be quick, to the point, where people go, oh, I get it, that's population health. So again, you might use something that's very official. You might use something that just seems to resonate with people a little differently. Next 11 slides, I'm just going to go through a little quickly, and these are actually just examples that you are welcome to use if you are wanting to have some visuals for a PowerPoint, for instance. And you'll see that the slides probably resonate with different stakeholders differently. But again, you are welcome to steal these slides. So here again is the definition of population health management, talks about care coordination, patient engagement, talks about finances and care models, talks about value-based payment, and there's a nice visual quadruple aim. Again, my guess is this is going to resonate a little bit more with probably senior leadership and C-suite folks. This one you may have seen because it's been out there quite a bit, and that is the triple aim of better care, healthier people, and communities, smarter spending. This, I think, can resonate with staff because, again, it's straightforward and to the point. This is the evolution of thought and practice towards population health, going from the patient is driving up our costs. Maybe we can do more to control costs. Maybe we need to redesign the way we deliver care. And this might be more, maybe a little bit more of upper or middle management. Total expenditures in millions by condition. And again, looking at how the different conditions are some of the where our spending is going for these different conditions. This one is just a nice visual that population health has a lot of determinants. It's not just our clinical care. You see, clinical care is 20%, access to care and quality of care included in that, but this is a nice visual to remind leaders and staff that as we're looking at population health, it's not just what we do with somebody while they're under our care, but it's also helping them to realize why we need to be asking them about, do you have, are you able to afford your medication? Do you have a ride to get to your next physician's appointment? So being able to help staff realize the bigger picture of population health, and that it's not just clinical care, but we really do have kind of a responsibility to think about some of these other issues if possible, so that we can help people to stay well and reduce readmissions. social determinants of health. Again, I think that this is really could be a nice definition to share with staff: the conditions and circumstances in which people are born, grow, live, work, and age, and then how these forces beyond our control might impact our health. And I think asking staff, you know, what are some of your social determinants of health that have impacted your health, and getting them to kind of think that through as well, to realize that it's not just about compliance or doing the right thing, that sometimes there are things that are beyond our control. This is a nice visual, just very straightforward and to the point, and as a nice reminder, I think, to frontline staff and middle management, that it's not just the hospital that impacts population health, but it's really pulling in all of these different entities. And then the incentive, again, what creates health, moving to how can healthcare engage, and probably again a little bit more of a middle to high upper leadership management visual. And then this can be another one for staff. It's just the basics of the why we're doing this, because we have to move out of an unsustainable healthcare system. It's important to improve experience and outcomes, drive down capita costs, create healthier communities. And then I think this is the last visual. I think what I like about this one is that during COVID and in the midst of COVID and ongoing during COVID, a lot of hospitals and communities really started putting into practice the ideas behind population health, as far as collaborating with mental health, schools, clinics, public health. Everybody started really collaborating to impact COVID in their community. And I think that that's a nice reminder that what we're talking about is, with our Hispanic population, for instance, why can't we do the same thing? Or with congestive heart failure patients, let's think about this in the same way, so it's not just hospital driven. Oh, this is the last slide. And then the destination, a health system that links healthcare with community stakeholders to create a network of organizations working together to improve population health. All right, so again, those are visuals that you are more than welcome to steal if any of them would be helpful to you. I do want to let you know of a couple of things that we have coming up. So we're working on 2 different projects right now for you guys in Minnesota. The first is we are creating a series of podcasts that are going to be geared to frontline staff. It's going to be 4 podcasts, each 10 minutes or less, that you could use in a staff meeting to educate staff on some population health topic that's relevant to them. And again, we are just working on these now, so stay tuned as those come out. And again, just a way to get staff engaged so that you're not having to recreate this. So that's one. The other podcast series is going to be for leadership. It's going to be 4 podcasts, each no more than 30 minutes. And it's going to be topics that are relevant to leaders. And each of those will include hospital guest speakers who will be talking about population health. And some of you may be invited to be our guest speaker. And this will be done more as an interview-like discussion versus a lecture or anything like that. So again, those will be coming out hopefully in the next 6 months or so. And then here are a lot of video and audio resources. The first few that are on YouTube right there, those again are created by different hospitals, and they were geared more towards helping their staff understand population health. The center, we recently created some video series that's around board education. And there's one in particular that is helping the board to understand the importance of healthcare transformation and population health. So if you have any challenges with your board, you might share that with them as well. All right. So what I'd like to do for the next, we're about out of time. Oh, sorry about that, gosh. So any thoughts? We're going to be moving on in just a moment to the post presentation polling questions. But any thoughts about anything that popped out today that you think, you know what, I'm going to use that? So I'd just be curious about anything that you think, you know what, I'm going to explore that a little bit more, see how we can use that.
This is Emily. I think that I think there's I really want to somehow include the experiential learning or have that with the nurses. So kind of get them out of their own, world and think a little bit more in the shoes of our population. So if you, yeah, I'll be exploring that some more.
Okay, great, good. Any others? Nope. All right. Well, we are also around if you guys ever want to brainstorm ideas. All right, so I think we just have the 2 post webinars coming up. So let's see. So this was the pre-education question, and now it's the post-education question about your confidence in educating hospital staff in ways that will engage and motivate them. You would take a moment now and respond to where you feel like you are right now.
Something, Rhonda, while they're doing that is that I just really want to encourage you when you get the slides, that list of resources there, to go to them, because especially like those first videos there's some really great short, this is what population health is. And a lot of the other information, it's just really good stuff, and that you can just fill in just in, places that you have things going on normally within your systems. So I just really encourage you to take some time and look through all of those resources.
Thanks, Deb. Keely, do you have a couple more polling questions to put up?
Yes, I do.
Okay.
Here we go.
So on a scale from 1 to 5, 1 being not at all, I learned something from this webinar that I would like to implement in my hospital. So 1 being nothing, 5 being absolutely. And then I think, Keely, you have 1 more after this.
Yep, just 1 more. Here we go.
And then on a scale from 1 to 5, overall, I am satisfied with this webinar. So thank you guys for responding to those poll questions. Thank you for the discussion. Thanks for jumping in and sharing your ideas. It's always more fun when folks are able to share ways they're going to use the information or things that you've done in the past. Please remember that we are here. If you need anything at all, please reach out to us, and look for the PowerPoint and the playback coming to you guys soon, and feel free to push that out to other folks in your organization that you think might benefit from it. All right. Thank you all so much, and I hope everybody has a good rest of your day.
Thank you. Bye.
Bye, everybody.
Thank you.